All right, everybody, and welcome to this practice session of Pros on Demand. So glad to see Coach Angie Hughes with us today. How are you doing, Coach?
I'm doing good. I'm doing good.
I always like those impromptu messages to say that, hey, I've had something come up, but anyway, we've got people that can slide right in there and make things happen, and so it's good to have you back again. We appreciate it.
Thank you.
And we're going to talk today about Medicare. That's something that's really probably a lot on people's mind all the time. I don't think I can go an hour or so if I'm watching TV without seeing Joe Namath on a commercial saying that, hey, we're entitled to these benefits and blah, blah, blah. You can have another $144 added to your Social Security check. So what in the world is all that about? Can you give us an overview of that, please?
Yeah, I can tell you. The Medicare industry, so it's a health insurance product, but I got to tell you, it's a very noisy industry. How do you compete with national commercials with famous people talking about all these wonderful benefits that they're entitled to, that they should get, and COVID? And, as insurance agents, we are steered very heavily, if you will, by the insurance department so that we don't use fear tactics when talking to consumers. And I almost feel like those commercials almost feel like almost like a curse word in our industry, right? Because it drums up more confusion than anything. Because if you need prospects to make your phone ring, start talking about Medicare, Social Security, extended care planning, all of that. I mean, there is just so much attention, and we kind of feel like we're out of that AEP window, and I'm going to go into what all that means. We feel like we're out of that. We can breathe a little bit better now that we're into the beginning of a new year, and that in fact isn't true, because actually what Joe Namath talks about is Medicare Advantage programs, which actually there's a window, a couple of windows for that, right? So now we're in OEP, which has to do with that. So it's a very noisy industry because there's a lot of rate chasing. I feel like it's a little bit of a rate war where the carriers are constantly trying to strive to not necessarily buy business. They've got to have very competitive rates. There are some states out there, like the state of Missouri, that every anniversary date you can jump from like plan to like plan. So if you have a Medicare Supplement Plan F, you don't like the rates that they have filed and what your rate increase is going to look like, you can just hop, skip, and jump over to a new plan. So some states are really tough to work in. And then other states, it has a tendency, Medicare is basically your health insurance, right? It's a federal health insurance program. And what a lot of folks don't understand is Medicare is a federally standardized health insurance program. Typically, we think it's for people as they turn 65, but as we all well know, individuals are working well past 65. So there are certain very important triggers that happen when it comes to Medicare. And so since it's a fee-for-service program, we really just kind of refer to Medicare as original Medicare. And then you kind of launch into this whole alphabet soup. What do I do with it? A, B, C, D, E. And then you've got all these supplemental plans that run from A to J. And then you end up with Medicare Advantage plans that have their own set of rules and regulations and certifications that agents have to jump through. So, a very noisy space in the industry. And yet it is a critical for some folks, the last major health insurance decision they're going to make, because if you need to look at the strength and of the carrier, their ratings and things, because if you're not a healthy person going into the Medicare platform, if you don't live in a state that lets you move every year, Kansas being one of them, Oklahoma being one of them, if you're not in that state, that could very well be your last health insurance decision that you make, because you can't medically be underwritten. No other carrier is going to buy a claim, if you will. So it's it's very important. I tell people, I work with a lot of property and casualty agents, and I lovingly say, don't dabble in the Medicare space. It's too easy to give wrong information.
Right.
But in the same breath, it doesn't take that much to get you educated enough, because you go through all of the trainings and the certifications that you have to sell Medicare Advantage plans. But for a Medicare Supplement plan, all you have to hold is your health insurance license. So most folks, unless you're living in a metropolitan area, so take Kansas, for example, if you're not in Wichita or the Kansas City area, you really don't live in a Medicare Advantage friendly city. Salina, we're a town of 50,000. Our regional hospital doesn't play very nicely with Medicare Advantage plans. So we have some folks that go into those plans because Joe Namath says it's zero premium, it's free, and we'll even put money in your checkbook on a monthly basis, and you can get all of these free benefits. Although our parents have raised us that there is not a thing in life that is free, it's still very tantalizing to have a conversation with an insurance agent if they can actually shave anywhere from $200, $300, $400, $500 off of your net expenses in a month. So
Right.
you've got to talk to that person that understands the dynamic of not only the region that you live in, but what the plans offer and if they really do work for you.
Right. Right. Well, I just think it can be so tremendously confusing. And for instance, my mother's, she keeps getting these things in the mail, and this and that. Do I need this? I don't know, but I've got somebody to call, and I've got somebody to go through a process with to kind of figure that out, because when they get a certain age too, it's pretty overwhelming very easily for a lot of those people. And
Yes.
there's just a lot of protective guards that you want to put up to make sure that they're being steered in the right direction and getting the right advice.
Well, and as you should, because my mother-in-law is 69. She'll be 69 in May. So I mean, not what I deem elderly by any stretch, but I'm here to tell you, at some point in time, your mind, your brain can only take in so much information, and at some point you almost, and I cringe to even say this, but you become prey. There are so many, it's not crazy. People buy lists of folks turning age 65. So there are vendors out there where you can actually go buy a mailing list. And if you are registered through, like I think it's the FTC or whatever, but you can get phone numbers as well. And so you can mail people turning 65, 68, 72, pick the age. You can mail them information about, all of these, kind of walking on that fine line between what's a scare tactic and what's not. And they're constantly bombarded with mail. Between the mail and the commercials that they get, all it's doing is setting in insecurities for them, and they don't really understand. And it's interesting to me because a lot of us go our whole lives either on group health insurance or individual health insurance. So the words deductible, co-insurance, co-pays, prescription drugs, it's not a foreign word to us. I won't go so far as to say, we all know what a deductible is. You pay that first, and then the insurance company is going to pick up something after that. You get into defining what is co-insurance, and they understand that means I pay some, you pay some. But if you were to tell a consumer your co-insurance is 80-20 to 10,000, they just heard you say out of pocket is $10,000, and that's really not in fact what that means at all. So we feel like we should be able to take somebody from that type of an insurance platform and kind of plug and play them into the Medicare platform, and it should be a fairly seamless transaction. And it's not seamless at all. Medicare in itself, because it's federally standardized, Part A and Part B of original Medicare are federally standardized. It covers the same thing no matter who you are or where you live. It's a matter of what are the gaps inside of original Medicare, and what do I need to pick up to fill those gaps? And so, I mean, I don't ever say that people can be insurance poor, but you can certainly have too much premium coming out of your checkbook on a monthly basis. I can understand that very much so. So what we try to do is explain to them how original Medicare actually works, and then where it has gaps and what is the best gap filler for you. Is it, do you buy a Medicare supplement policy, which is typically what we've known in the past? Everybody kind of, this is what I would get from consumers. I'd like to have that Medicare policy that just pays for everything. I want the one that pays 100%. I don't want any out of pocket. I don't want to get any bills.
Right.
What they're referring to is Plan F, a Medicare Supplement Plan F. So you've got Part A, Part B, and a Supplement F. And that's picking up basically the gaps, because original Medicare in and of itself pays for about 80% of your healthcare costs. So your supplement comes in and picks up the gap of that 20%, kind of fills that in. Well, there was Medicare Modernization that was passed as of January 1 of 2020 that said, all right, we got a lot of folks. And if anybody ever runs out of prospecting ideas, I will tell you, this is why everyone in the United States, if they can harness the opportunity, there are 10,000 people, and have been 10,000 people a day turning age 65 every single day for the last 10 years and for the next 10 years. So there's a huge prospecting opportunity there. It's a matter of how does that fit into your book of business, and how involved do you want to be with that? And a lot of the agents that I work with are property and casualty. So it's not their bread and butter. I'm asking them to basically learn something completely different and necessarily not in their skill set. And that's why a lot of times this is what one team does.
Yeah.
They pair you with that professional. How great would it be to say, this is such an important decision to you, and I have professionals in that field. And this is exactly what one team is designed to do. Because again, I go back to the adage, how many hats can one person wear?
Right.
You know, outside a cat in the hat, not all of us have that much brain space.
Yeah. No, thank you for making that point, because that's exactly, what it does. And the other thing too, again, I think implementing the technology that we have available now too,
right.
It may put somebody in connection with the local representative, but also we can bring you to the table in that setting as well to really get the full expertise experience of all this. So it really becomes a great team effort, so to speak, utilizing this platform, I believe.
I kind of wanted to, not that anybody on this pro call necessarily wants to be a Medicare expert, but just to kind of reinforce a little bit about why, not that you have to jump in with both feet, but if this is something that you want to explore, and why it's so important. First off, if you've never gone through the Medicare process or enrolling for your Part A, which most people write, typically what we used to say in the past was once you become 65, if you've worked your 40 quarters, which is really if you've paid taxes for 10 years or more, you're eligible for Part A, zero premium Part A. You get that. Well, Part A covers, and this is how I distinguish it in my mind, Part A of original Medicare pays for your hospital bills, because you need to think of it in this. If you've worked and paid your taxes for 10 plus years, you get that portion of your Medicare for zero premium, because your hospitalizations are very much the most expensive level of your, that skilled care. That's your under watch 24 hours a day in a hospital type of a thing. Then you go into your Part B of Medicare. Now, Part B is where it becomes very interesting, because when you enroll in your Part B, that is what's going to trigger your one-time open enrollment window, which typically is 3 months before your 65th birthday, the month of your 65th birthday, or 3 months after your 65th birthday, unless you're on group health insurance and you decide to stay on it. And it depends whether there's 20 more or 20 fewer employees. But that's what dictates enrolling into that Part B premium, is what's going to open up your Medicare windows as to what is exactly your guaranteed. I'm jumping in for the first time. They can't look at my health history. That's what dictates that. And so a lot of folks rely on their HR director. If they're on a group health insurance plan,
Right.
they rely wholeheartedly on that HR person to tell them, look, I'm going to retire. I'm 69 years old. I'm going to retire. What do I do? Or I'm turning 65. I want to stay working until I'm 70. What do I do? If that HR is not really in tune, and I'm telling you, there are some that are very much in tune with this and understand it, and there are some that really don't understand it at all, and they'll just tell you to jump right into Medicare. Well, you've just opened up a window that's going to close on you, and you really don't need that. And so you're going to pay premium for your Part B. You're going to pay a premium for your group health insurance. Depending on the number of employees are at that place of business, dictates whether or not Medicare is primary or secondary. It could just cause a lot of turbulence in your planning strategy for post-working years. So it's really, really, it's very, very important. So like I mentioned, Part A of Medicare covers your hospital. Part B is covering your doctor's visits. And there's a whole lot more to that. I'm trying to simplify it as much as I can. Then you get into the commercials, the Joe Namaths of the world, and everybody that's talking about all the free coverage that you can get, and you should actually get money back from, the give back benefit thing. And by the way, that's very regionalized. Everything is, for Medicare Advantage plans, everything is very much zip code driven. But if you decide to take a Medicare Advantage plan, you are actually replacing original Medicare. So not to be confused with the fact that you don't have original Medicare. It's just what you've done is you've said CMS, which is the Centers for Medicare and Medicaid, they're the ones in charge of the Medicare health insurance. When you go into a Medicare Advantage, also known as Part C, so we've covered Part A, Part B, now we're on C, you're saying to CMS, you don't have to take a look at my insurance bills. I'm turning that all over to an insurance company. So the insurance company has to cover exactly what original Medicare covers under A and B, and then they start throwing in a lot of stuff. Now, this isn't smoke and mirrors. Insurance companies don't charge a zero premium because of the, love in their hearts for all of the consumers. They're getting stipends back, right, from CMS based on Medicare beneficiaries out of that zip code. There's money given to them for that. It's their responsibility to properly and actuarially manage that book of business, hence managed care. Right. So that's the Part C of it. And then you go from A, B, C to D. And D, luckily, this makes sense. D stands for drugs, right? So Part D is where everybody has to have a drug plan. And that was signed into law in 2006 by George W. Bush. So that's kind of your ABC D of original Medicare. And then we really don't ever talk about Part E, which really are your cost plans, or that also kind of, we call them our Medicare Supplement plans, but we don't call them Part E. We just call it a Medicare Supplement, or they call it a Medigap plan because it's filling the gaps of original Medicare. You cannot have a Medicare Advantage plan and a Medicare Supplement plan. You're going to pick one of the two. Some of your Medicare Advantage plans cover your prescription drugs. Some of them don't. So you would pick a standalone drug plan. So there's just, there can be an awful lot of knowing what's right in your community when you get into Medicare Advantage plans. I'm not a hater of them by any stretch. I just happen to know in my hometown, they're not liked very well by the local hospital. Well, if that's the only hospital we have in town, right, then obviously your insurance is, if it's out of network, that's not going to be very good for you at all. So there's a lot of things that we have to look at when it comes to that. And I'll tell you one thing that's really overlooked, and I don't know how often we run into this, but a lot of folks don't realize that you actually could pay more for your Medicare depending on your income. So there's this little thing called IRMA. And if you know the government or CMS, everything has an acronym, everything. So IRMA stands for Income Related Adjustment Amount. And so if somebody's making between the chart for 2021 is if you're making between $111,000 and $138,000 annually, your Medicare Part B premium is going to actually go up to $297. whereas most folks understand it to be about $148.50. So there is and it's based on 2 years prior taxes that you file. So that premium could come down some as you file your taxes and maybe your retirement income starts to level out on you. So, there's just a lot of things, and I'll tell you how much they love acronyms. When we start looking into enrollment periods for Medicare, you have the ICEP, the IEP, the AEP, the SEP, the OEPI, and the MAOEP. So,
wow. So much for the ABCs. Yeah.
That's why I call it Medicare is the alphabet soup that you need to have somebody spoon feed you that soup, because you have to understand and when it comes to all of these rules and regulations really do truly follow more of the Medicare Advantage platform. It is very heavy regulated. Any insurance agent that sells an MA or a prescription drug plan, they have to certify every single year, not only with kind of the grand poobah of, it's called AHIP. You have to go through their certification, and the agents are paying money to do that. You then have to certify with each and every insurance company that you want to sell for. And that, luckily, we don't have to pay to certify there, but you have to pass the one you paid for and then certify for each and every carrier, because these enrollment periods are serious. If somebody goes in a wrong enrollment period, or they don't use the right code, they are just rejected out of the Medicare system. And then you got to kind of fight your way upstream to get that figured out. So I've kind of spent a lot of time talking about that, and I don't want to scare anybody away from it, because it is a good revenue source for agents. It's a good prospecting source for agents. Certainly. I mean, if it wasn't a relevant topic, you would not still see Joe Namath on TV advertising commercials.
Right.
You would still not see, the Humana commercials and some of the bigger companies that you see, the Aetnas of the world and stuff. So it is definitely a viable space.
Yeah, for 10,000 people a day turning 65, and at least for the next 10 years, I mean, that's a pretty huge deal. And this is really why I keep going back, and I thank you for saying about one team and how valuable this can be in this sense, because we have the ability to get the people to the right people, to make the connections with you and your team and your agents out there that can eliminate a lot of the confusion, the distractions, the noise that's in this space, as you mentioned. And so I think that there's such a viable opportunity to really provide a tremendous service on this platform in such a way that we really haven't had a chance to tap into yet, but I think that's coming. And so that is such good information.
Michael, one thing I wanted to add, I want to make sure that all the coaches and the players that are participating in one team, my bio says, oh, this is Angie Hughes. She's based out of Salina, Kansas. Here's the beauty of this. If I'm at the coach level and I'm a national distributor, national means I'm in every single state. The great thing is you're not going to have to, I can pair you up with somebody that you can actually meet face to face. You can shake their hand. You can see their eyes. I've got agents in every single state. So if that personality doesn't fit with you and you want to work with someone else, I'll go find you someone else. So I didn't want there to be a disconnect that, gosh, how do I work with her? I mean, that's great. She's got that knowledge, but what about somebody locally? And the great thing is the folks in my line of business who I pair you with, they're not your competition.
Right.
They are a teammate, just like you would want if you had someone admin sitting in your office helping you get through your day-to-day process. All we're trying to do is retain clients and build a deeper relationship with your clients. And the whole idea around this is just a beautiful process.
Yeah, very well said. Angie, you always put things in such a great way. We certainly appreciate that, because I think that brings it really home to everybody in such a great way. And we understand now that, again, through this platform, through the technology, through our resources, the talent that we have available in the field, the skills, the training. I mean, there's no city line, county line, or state line that really prevents us from connecting, at least this way initially. But again, like you say, hopefully, face to face, or with that can reinforce that relationship. And so I think this is just a tremendous opportunity, I think. And again, there's so many questions and things that come up around this particular topic. And I'm sure we can talk a lot more about those different things as well in future practice sessions. Disability is another thing that'll be coming up that we'll want to talk about. That's a huge need. People overlook that a lot of times. So that may be in line for our next one. But I really appreciate those things that you've said, because I think it makes a great difference. We're going to wrap this practice session up. And again, thank you, Coach. If you're joining us live, stay with us. We're going to have a time for some more questions and discussions coming up with Coach Angie. But if you're listening to or watching this recorded practice session, I want to remind you that our Pros on Demand highlights are available anywhere, anytime, every time for all of our One Team members at oneteam.pro. Pros on Demand practice sessions are scheduled Monday through Thursday at 3 p.m. Central Standard Time, where our discussions will be on specific topics and feature one of our professional coaches like Coach Angie. Hey, with that, we're going to wrap up this recorded practice session of Pros on Demand.